2 decades ago, when I got started, a search through the literature for the topic of burnout in resident physicians might turn up 100 papers. Today, it feels like there's that many papers published every week on the topic. Workplace well-being is fundamental to healthcare delivery. It directly impacts job satisfaction, productivity, engagement, retention, and ultimately the quality of patient care. These aren't abstract metrics. They define healthcare effectiveness and long-term business success, certainly for us here at Mount Sinai and for our almost 48,000 employees. Addressing this issue requires more than awareness, however. It demands organization-wide commitment and a strategic, structured approach, one that's realistic and includes actionable solutions. Such a commitment means making workforce well-being a core priority. Leadership has to take ownership, dedicate resources, and embed it into overall institutional strategy. Structured frameworks are essential to drive meaningful change. There are various approaches to take. Some might seem simple, others are more complex. But the goal remains the same: to identify those key factors and drivers that are influencing well-being, and then translate those into meaningful action. The goal isn't necessarily to create the perfect framework, but one that works and leads to positive change. Action turns those insights you measure into impact. It's essential to measure the right factors, to understand what those are, and ensure that the solutions are data-driven. But data-based solutions alone aren't enough. They actually have to reach those that you're intended to impact, the folks on the front lines, those who can act. For this, strong partnerships with institutional leaders are key to help translate those findings into change. Over time, the sum of all that incremental local change will lead to global improvement. The responsibility is ours to empower individuals, strengthen teams, and transform organizations.